Good afternoon. I'm Lucy Beadnell, the Director of Advocacy with the ARC of Northern Virginia. I'm really excited to be talking to you all today about the basics of Medicaid waivers in Virginia. And since February now is National Therapeutic Recreation Month, we'll really highlight how some of the waiver services can be used with and to facilitate social and recreational options. I'll send a follow-up email to folks who have attended this session or signed up for it with a link to the recording, as well as a handout on some social and recreation options available kind of inside and outside of the waiver. But if you ever have any questions, feel free to reach out to us at the arcofnova.org/answers, and we're really happy to help. We'll go ahead and get going here. The ARC of Northern Virginia is about to celebrate our 61st birthday. That happens next month. We've been around a long time. A lot of what we do is advocacy. So as we'll hear today, the waiver system is not perfect. It's not perfect anywhere, but Virginia's has some real significant issues. There are all kinds of other things in our state that aren't ideal for people with disabilities, laws, regulations, funding, and so we do a lot of advocacy to try and change that. Meeting with legislators, and that involves people with disabilities and their families telling their story. Something like a Zoom living room meeting where you tune in and I tune in and a legislator tunes in and we talk a little bit about what's working for you. And then I'll give some legislators ideas about things that they can do to fix it. So if anything you hear today, you feel like, oh, that's not ideal, let's talk about hosting one of those meetings, right? You all are, just by virtue of being here, are showing up as parents, as loved ones, as caregivers, as people with disabilities who want to make our system better. We do a lot of education. That's things like this workshop. So if you need something like this for a specific group that you're a part of, or need recordings, handouts, toolkits, those kinds of things, we're happy to share. We do a ton of free information and referrals, so directly answering questions from people with disabilities and their support networks to help them figure things out. We have a team in our office of case managers who work with people with the Medicaid waivers, and another team of people who are guardians of last resort. We operate a special needs trust, and I'll touch on that a little bit later since it relates to waivers to some degree. And our coolest and hippest team is our Tech for Independent Living group. And they work through grant funding, so totally free to use, on apps that help people with disabilities be more independent at work or at home, travel more independently, be safer, those kinds of things. So if that sounds of interest, please feel free to reach out to us, and I'm happy to put you in touch with that team. And you don't need a waiver to use them, I should say. So in terms of what we'll discuss today, we'll talk a little bit about what is a Medicaid waiver, right? How would I know if I'm eligible? And what are the services? And as we talk about those services, I'll highlight some services that pair really well with social and recreation interests and options. Then, since we'll have a good base knowledge about what the waivers are and why they matter, we'll talk about how to apply. And at that point, we'll talk about, which waiver you may want to apply for and what that would look like. And then for the waivers with a waiting list, we'll talk about how do you know how long that is as best we can guess, how do you prepare for it, those kinds of things. And we'll end with my contact information. So you can't ask me or the ARC in general too many questions. Always feel free to reach out and we're happy to help. So we'll jump right in with the purpose and description of Medicaid waivers. So they're called Medicaid waivers because Medicaid, the state and federal partnership, is the organization that oversees them, that writes the rules, that pays for them, those kinds of things. This is a little different than traditional Medicaid health insurance, which would pay for things like doctors and therapies and prescriptions. This Medicaid is covering long-term care. And usually when we offer services through Medicaid, it goes to everyone who has Medicaid. The Medicaid waiver means we actually want to offer special services, additional services, just to some people. We want to waiver a granted permission to do that. So you're not waiving away something else by exploring the waiver. You're saying, oh, I'm part of a unique population that should get some extra services, and they happen to be funded and regulated through Medicaid. We talk about waivers a lot at the ARC of Northern Virginia because to a large degree, they're meant to be the one-stop shop for people with disabilities across the lifespan. So it's just as appropriate for little ones who are brand new born and have a significant disability as it is for teenagers, as it is for adults or people aging in place. It's just as appropriate for people who have relatively few but ongoing support needs as it is for people who need 24/7 coverage. So it really is the only public meaning free or low cost, way to fund ongoing supports for people with disabilities. So they're really, really critical to get in place if you or your loved one are going to need long-term support, meaning not just for a couple of months or weeks, but really over the course of their lifespan. We anticipate that person's going to need some kind of assistance. There are two types of waivers that we're going to talk about today, the two types in Virginia. The first are the developmental disability waivers, and there are actually three of them. Their individual names are the community living waiver, the family and individual supports waiver, and the building independence waiver. But the eligibility criteria is the same for all of them. The application process is the same for all of them. The waiting list is the same for all of them. A little bit later today, we'll talk about how some of the services are different between the waivers, but for the purpose of our discussion today, really they're one unit, or three developmental disability waivers, and we'll talk about how you would apply for them, why, and how to navigate them. The other kind of waiver offered in Virginia is called the Commonwealth Coordinated Care, or CCC for short, Plus waiver. And if you knew about the waiver system prior to 2017, you may have heard the names ED/CD waiver or Tech waiver. They were very similar and they were combined in 2017 to make this other waiver. So as we talk about things today, and our next slide will give us a high-level overview, I'll compare our DD waiver system to our CCC Plus waiver system. And you'll figure out, do I want to pursue one, the other, or both, and why? So let's dive into that kind of high-level comparison. For the DD waivers, you're going to need a developmental disability diagnosis. That's what the DD stands for. So likely if you're here, you know what that DD diagnosis is. We'll talk through some particulars in just a second, but if you have any questions, feel free to let me know. That would be things like autism, cerebral palsy, Down syndrome, a big range. There's not a comprehensive list. The DD waivers are great because they have a really big menu of services. Everything like we talked about, from little ones to work, to living with your family, to living independently kind of services, to nursing services. You can get staff up to 24 hours a day if you need it. It comes with a case manager, generally called a support coordinator, whose job it is to help you navigate the waiver and services outside of it. So you would sit down with them and say, this is what a good life looks to me. And they would say, okay, here's how the waiver can support you in meeting those needs. And here's some other ideas on how we meet those needs, right? Their job is to put that big picture together. The downside of the DD waivers is they have a significant waiting list. And as promised, as we get through the application process of waivers, we'll talk about what that waiting list looks like. It's a little tricky to explain. It deserves some time all on its own. But just know, generally speaking, it's not a waiver you could get immediately. And that's why we talk about the CCC Plus waiver. It requires some kind of disability diagnosis, which could be a developmental disability, and a medical need. In a little bit, we'll talk in some more depth about what that is. And be clear here, I'm not saying medical diagnosis alone. I'm saying a medical need, meaning on an ongoing basis, someone needs some kind of specialized medical or therapeutic care. It is a much shorter menu of services than the DD waiver. It is meant to keep people out of nursing homes. It's aimed at an older population, but there's no age minimum. And as a result, since it's meant to keep people out of nursing homes, there's not employment services. They're not traditional residential and the same kinds of community-based services as the DD waiver. There's a 56-hour-a-week cap, so 8 hours a day on average, for a care attendant, someone to work one-on-one with a person with a disability. So not anywhere close to 24/7 coverage, really. And there's no case manager to help you put all those big pieces together and come up with a short and a long-term plan, but there's no waiting list. So at any given time in the last decade, I'll say, about a quarter to a third of people waiting for the DD waiver had enough medical needs that they also qualified for the CCC Plus waiver. And when that happens, what folks usually do is put themselves on the waiting list for the DD waiver and apply for the CCC Plus waiver and use those services. Even though they're not everything the person needs, they're something, and it's a really great lifeline. And then once the person receives a DD waiver, they give up their CCC Plus waiver to get all of those services plus more. There's nothing that the CCC Plus waiver offers that the DD waiver doesn't. So at that point, you give up the smaller menu of services and get the larger menu under the DD waiver. Of course, if at any given time, a quarter to a third of people are able to use that CCC Plus waiver, it means the majority of folks aren't, and that's okay. We'll talk through DD waiver options again as we go on, but kind of keep in mind, if you are a person or you have a loved one who has both a developmental disability and a significant medical need, there may be a way to get some support a little bit more quickly. Okay, so now we'll talk about how we know if we're eligible for these waivers. And you know in 3 different ways, and you have to meet all of these 3 different ways. 1, your diagnosis. You've got to have the right diagnoses for the waiver. 2, you have to have the right functional needs, meaning you're not just saying, I have cerebral palsy, for example. You're saying, I have CP, and I also have significant support needs that go along with it. And let me tell you what those look like. And lastly, the waivers have financial criteria. Because it is a program through Medicaid, we'll talk through what it's like to qualify for them financially. Okay, this is a super wordy slide. Like I promised, we'll go back and forth between the DD waivers and the CCC Plus waivers. It's cool with me and everyone if you never read this slide. It is a very long way of saying this is what the state uses to define developmental disability. Likely you know if you have a developmental disability, but when I say kind of the standard accepted definition, usually someone rightly chimes in and says, what is that? So now you have it in black and white, but we're looking at before age 22, when that front part of our brain generally finishes growing in our developmental period. We had a mental or a physical impairment or both onset that we think is going to continue indefinitely. And it results in some functional support needs in a couple of areas of our life, at least 3. Those life areas are listed there in the middle of the screen and underlined. And because of those support needs, we're going to need some help, is basically what that definition says. If you or your loved one are under age 9 and are looking at applying for this waiver, that definition's a little more fluid, right? For anyone who's ever gotten a child diagnosed, it can be real tricky to get the exact right diagnosis, especially when they're tiny. So there's a little bit more leeway. But if you have a loved one currently going through early intervention or child find, we're in kind of a gray area, but it's looking like maybe we have a disability that's going to be ongoing. What you have through those public services is likely enough to start applying for the waiver in terms of a diagnosis. So I say all this to say, don't wait to apply. If you're not sure the diagnosis that you already have is enough, you are welcome to reach out to me, and I'm happy to look at your stuff, or we can talk about how you'll apply for the waivers, and the people who are screening your application can look through those documents too. And if they need more, they'll tell you, and they can talk about ways, and I can talk about ways with you too to get more diagnosis information, but please don't ever let that hold you up from applying. We certainly want to make sure that people can get services as fast as possible. And the CSBs, the agencies that screen people for the waiver, are usually pretty good at figuring out whether or not we have enough diagnostic information on hand. Okay. So now we'll talk about, remember I said we'll go back and forth between the DD and the CCC Plus waiver. As promised, here we are. So the CCC Plus waiver in terms of a diagnosis is looking for some kind of disability like we talked about and some kind of medical need. You know, if there's a medical need, there's going to be some medical diagnosis, of course, but the need part is more critical here. And so what do I mean by that? Let's say, for example, we take something like epilepsy as a diagnosis. For sure, if we've got someone with, let's say, autism and epilepsy, we've got a disability diagnosis and medical diagnosis. Then the question comes to, is there a medical need? And if you told me this person is 35 and they haven't had a seizure since they were 4, and you don't go to the neurologist anymore or take any seizure meds or have a seizure protocol, then that's not what's going to be considered a medical need. There's not a need that's being met to address that on a daily basis. But if instead you said, same person, 35, has autism and has epilepsy, but they have seizures pretty regularly. We see the neurologist a couple times a year. We do have seizure protocols. We do take seizure medications. People who are around them are trained to monitor for those seizures. Now we're looking at a significant need. So there you can kind of see the difference between, it's not the medical diagnosis really that matters. It's, do you have needs related to that diagnosis? I'll send these slides out, or you can find this on our website on our waiver handouts, but in green in the middle of the slide there is a self-help eligibility tool that I really like. Because this kind of medical need criteria is a little fuzzy, right? I can't say yes or no, that diagnosis will qualify you. That's a great quick online questionnaire. It's nothing official, but it'll give you a sense of, is this person likely to be eligible or not? If, as you hear what I'm saying, you're thinking, maybe it's worth it to apply, maybe not. I will say my opinion is never hurts to apply for any program. And if you're turned down for this program on the basis that you don't have enough medical needs, who knows when that will change, right? It could be the next day or 6 months or a year later that the person gets a new medical diagnosis or a new medical support need related to the diagnosis they already have, and then you can reapply. So there's no harm done by applying. I would say don't waste your time if the person has absolutely no medical needs, but if you're unsure, it's worth that. Now we'll talk about functional needs. So now we should have a sense of kind of the diagnosis we're looking for in applying for waivers. Second, we'll talk about functional needs and how that's scored. For all of the developmental disability waivers, the same test is used. It's called the VIDES, which is an acronym for the Virginia Individual Developmental Disabilities Eligibility Survey, which is such a mouthful. That's why we call it the VIDES, right? And there's different versions because here we're trying to see, does the person with a disability have notably more needs than their similar aged peers? So there's a version for people who are just born till the day before they turn 3, people from 3rd birthday to the day before they turn 18, and for adults 18 and older. And that VIDES is going to look at 8 categories of life, and they're listed here. Your health status, how well you communicate, how well you learn new skills, how well you take care of yourself. Those are things like bathing, dressing, using the restroom, mobility, getting around, behavior, how well we monitor our own behaviors with the outside world, community living skills, how safe are we out and about in the community and how successful are we, and financial self-sufficiency. Are we good with taking care of our own money and finances? To be eligible for the waiver, we need to have eligibility in 3 out of these 8 categories. One of the things I like about the VIDES is it was revised a few years ago. And first of all, it's public, so you can see it before you apply. But they now have the VIDES questions written out in terms that I think are pretty family friendly and understandable. So if you go to our website, thearcofnova.org, and across the top, you select Resource Library, then Waivers. It'll take you to the whole online library section we have about waivers, and the VIDES is linked there. And my 2 cents is, if you're ever going to take a test and someone gives you the questions in advance, look at the questions in advance, right? There's a scoring guide right on the front. So at home, you can go through, answer all of those questions. If there are things that are awkward to talk about, like bathroom habits and things that we may not want to share with strangers, it's a good time to prepare yourself and or the person with a disability, talk about what you're going to say and share and what's okay. It is certainly important to be honest and to stress the needs of that person. And once you practice on the VIDES, you write down all your questions, you can go right back to the beginning and say, oh, based upon what I said in this category, we're eligible or we're not. We're eligible or we're not. And you'll go through all 8 categories and you'll have a very good sense of whether or not you're going to be deemed eligible for the DD waiver. If you have questions about the VIDES, certainly feel free to reach out to us. If you want to take your copy with your notes and examples to when you actually do the VIDES interview, you can do that too. Like I said, it's a public document. There's nothing secret about it. When the person asks you the questions officially, they're not going to take your copy. They really do have to meet the person with a disability and they really do have to answer the questions. But you can have any notes or things you want to prepare you. For the CCC Plus waiver, eligibility is looked at in a different way, with a uniform assessment instrument, and the link to that's on the bottom of the screen. And it's a really heavy focus on personal care, bathing, dressing, restroom, getting around kind of stuff, and medical care. Because like we talked about, this is the waiver that requires a medical need to be eligible. So I don't like the UAI as much as the VIDES because it doesn't have a scoring guide on the front, meaning even if you looked at it and answered all of the questions, you can't go back to the front and see, oh, am I for sure eligible or not if my answers are written down this way? But it does give you a sense of what they're going to talk about and what's important, which is, again, medical needs and personal care. And it asks a lot of questions about those kinds of things. Okay, so now we'll talk about financial eligibility. And this time, instead of going back and forth between the DD and CCC Plus waivers, I'll say mostly financial eligibility is the same between the 2 of them. For either of those waivers, the person with the disability, really emphasize this, the person with the disability getting the waiver, not parents, not whole family. It doesn't matter if the person's 2 months old or 20 or 200. Only the person with a disability's monthly income is considered. So for children applying for the waiver or getting the waiver, that income is usually zero, as children are usually not income earners. For adults, that income in 2023 dollars, that limit is $2,742 a month. And it adjusts with inflation because it's pegged to a Social Security benefit amount that adjusts with inflation. Once the person with a disability starts earning more than about $1,400 a month, they start to have a copay for their waiver services, meaning they're buying into you some of their waiver services. But anything under that amount is their income. There's no cost whatsoever to use as many waiver services as they need. For adults using waiver, there's a $2,000 resource limit. So that means at the end of every month, all of their countable money put together, checking account, savings account, if they have stocks or bonds in their name, those kinds of things have to add up to less than $2,000. Since children don't generally legally own property, there's not a resource cap for them, though they still look at the child's income. Since, for example, the child could get income through like child support, or if there was a birth injury or those kinds of things, they may get less. Now, what if you're thinking like, oh, $2,000 resources is like not very much money? Yes, that limit was laughably low in 1989 when it was introduced. Now in 2023, it's just ridiculous. So if the person with a disability has now or is ever going to likely have more than $2,000 in assets, it's a good idea to explore a special needs trust. It's a kind of bank account where you can save money. The money is only for the person with the disability, and things that they need, Medicaid, waiver, Social Security, etc., will look at that trust, but they can't count the money in it. So for example, if someone with a disability inherited $5 million from their grandmother, and that money went directly into a special needs trust, then they could still be eligible for waiver, right? Even though this person is technically a millionaire, because the money and the assets that they have are in an account that Medicaid waiver is not allowed to count against them, then they're continuing to be eligible for waiver, which is very cool. The arcofnovatrust.org is our special needs trust website, and I am super biased toward it because right across the top, you can select events. And there are, usually several times a week, free, virtual, and some in-person events where you can go. Small groups, large groups, hear a presentation, ask questions, those kinds of things. And on that same page, you can set up a one-to-one conversation with our trust team if you want to explore this in more detail. Okay, so now we'll talk about services. And please do keep in mind that services will be matched based upon the person's needs. So I'll give you a sense of what services are available under the waivers. But if I talk about a nursing service and your loved one has no nursing needs, that wouldn't be offered to you, right? Which kind of makes common sense, but just to be clear. Okay, so this looks overwhelming at first. We'll go through it together. Across the top, you move with me, we've got the community living, family and individual supports, and building independence waivers. If you may remember from the beginning, those are the 3 types of developmental disability waivers. They're all together kind of a bundle when we talk about eligibility, applying, waiting list, those sorts of things. On the far right side of the screen is the CCC Plus waiver for people with medical needs. And over these next few slides, we'll sort of compare them. And any service that has a little sun logo next to it means this is something that pairs well with social and recreation opportunities. And again, we're highlighting this for Therapeutic Recreation Month, which is February. This first slide looks at residential options. And as you'll see, all 3 of our DD waivers offer some form of residential options. The community living waiver, that first one in the column with most of the X's, offers 24/7 residential options in a bunch of different varieties. So that's a great waiver for people who have our highest level of support need. The family and individual support waiver, you can kind of think of as like a middle tier waiver. And this I usually think of for people who need more than a couple of hours of drop-in services a day, but less than 24/7 awake and looking at you services. So the majority of our population generally. The building independence waiver is for people who are over 18, living away from parents or grandparents, and need relatively few hours of support each day. Maybe they need someone to drop in and check on them each morning or each evening or both. Maybe they need some supports on the job, but we're really talking about someone who can be independent or safely alone for large parts of the day. And on the far right, again, the CCC Plus waiver, you'll see offers no residential options. And I just put that here on the screen for the sake of comparison. So as we talk about the residential options, the most traditional and sort of oldest model is this group home, where you've got 3+ people, but usually more like 5, 6, 7 people who don't usually know each other, living in a house together, and staff rotates in and out of that house with multiple people in the house at most times, 24 hours a day. So in this model, there's lots of people, there's lots of coverage, but not a whole lot of choice. So in this situation for social and recreational options, we're usually looking at things, what does the whole house want to do together? And staff can help support people in those options, or what do people want to do at home? Often residential programs have access to one vehicle. And so if everyone wants to do something different for social and recreation options, there's lots of compromising, as you can imagine. The next waiver service is available under all 3 waivers, and that's called shared living, where the person with a disability lives with someone, generally speaking, who doesn't have a disability, not their parents or grandparents. Sometimes it's a sibling, but usually it's just somebody else. That companion, if you will, is reimbursed for all of their living costs, which is in Northern Virginia like a pretty big deal. I shouldn't say all. So like their rent, their internet, their utilities, those kinds of things are all covered. And in exchange, like they're there overnight as eyes and ears. They can sleep, just like you as a parent sleep overnight, but you're on call overnight for our kids, right? I've been on call a lot overnight. But they can sleep, and they can provide a little bit of help around the house in exchange for that free room and board. They can certainly do social and recreational activities with the person, or you can use that service for some hours of the day and bring in someone else who does other social and recreation or other kinds of supports at different times. So the reason shared living is offered under all 3 waivers, despite we have people with very different needs on those, is because if you only have a few needs, it may stand alone. If you've got more needs, you may add in services on top. The independent living service is for people, again, over 18, pretty independent, working on a little bit of skill building here and there. So maybe, for example, we have someone who is safe alone, but we're still learning to plan and cook healthy meals, and their staff are working with them on that sort of thing. Absolutely, it could be working on a social skill or a recreation opportunity. For sponsored residential, this is an option, again, where the person with a disability is living with the paid caregiver, but the paid caregiver is usually the only at-home caregiver, whereas with shared living, we talked about layering in other folks. So with sponsored residential, this is easier with examples, right? So let's say someone who was a group home manager, a teacher in special education, et cetera, says, sure, I'd love to have someone with a disability live with me. And just like parents do, yeah, I'll be here in the mornings and every afternoon and on the weekends, and we'll hang out together and we'll live our lives together. Sure, if there's sometimes I need a break, we can make plans for that. But for the most part, that sponsored residential provider is there with them all the time. Sponsored residential is limited to a maximum of 1 or 2 people with disabilities living in the home. And so great service if the person has lots of social and rec interests, because the caregiver only has one person that they're serving, right? So lots more options for customization. There is a service that we're advocating for more funding now because it's just very exciting and is the most viable, I think, residential option for people with that family and individual supports waiver, called supported living. And that would be, imagine like a shrunken, customized group home. So instead of 5, 6, 7 people, you don't choose staff, you don't choose, we're maybe talking about 2, maybe 3 people in a condo townhouse kind of situation. Staff they choose and like on a schedule that they need that can help them fulfill their own wishes, social and rec, in-home caregiving, etc. So really smaller, more personalized, more flexible for the person. Okay, so we'll go on to employment services. And here again, if you look across the top, you can see our 3DD waivers really all offer the full range of daytime and employment services, and you can mix and match them. You could do, for example, one service on one day and another service 4 days a week, or one service one day, another service another day, another service another day, etc. Again, for comparison, the CCC Plus waiver doesn't offer any day or employment services. Under the waiver, there are a few things that pair really well during the day with social and rec options. So those would be things like community engagement, where we're going out into our community, we are learning new skills, we're working with people around us. Day support, which could be out in the community when we're just kind of learning about life, we're getting direct care. And community coaching, where someone is working one-on-one with a person with a disability to learn a new skill, break down a barrier to employment or to greater independence, those kinds of things. Because when we're really working on something that's tough for us, that one-to-one skill can be really valuable. There are also other kinds of employment services in a small group or individually where the person with a disability is supported in learning a job and earning a living. And along with these services comes benefit planning, because like we talked about, there's income and asset caps we want to be really mindful of. And there's free people to help you figure out, okay, this is how much we can earn, and this is how it's going to work with your waiver and how we can enroll you, and sometimes even special programs through Social Security to make sure you're earning the most. Now we'll go to services that can take place in-home, and we'll see our CCC Plus waiver finally kind of shows up for us here a little bit. And by in-home, I mean, if the person with a disability is living with parents or grandparents or siblings, or living in their own home. And those are things like one-to-one caregiver is the most common service used in this setting. Someone who you can hire to do things like bathing, dressing, using the restroom, homework help, researching things online that the person would like to do to plan for college, lifting the person and helping them take a shower, helping the person go out and navigate the world, their community sports league, whatever that is, right? That service can be as varied as the person is. There's a similar service called in-home skill building, which instead of just we'll go out and do these things, is a fair amount of charting, right? We are specifically trying to reach this goal in our activities. We are charting whether or not we're getting closer to it. All of our waivers, except for the building independence waiver, offer up to 480 hours a year of respite, like a break, for the unpaid caregiver. So if this person has an unpaid caregiver, usually a parent in their life who's covering a lot of care, there's up to 480 hours a year where that parent can say, you know what, we don't usually have care scheduled right now, but I'm having a surgery, I'm going out of town, I'm going on a date or a trip, and we need some extra care. And then all of our waivers offer up to $5,000 a year to change the home or the car of the person with a disability to adapt it to them. And all of our waivers based upon need offer a personal emergency response system where you can just push a button and emergency services are called and tell them about that person, where they are, what they need, who to send, that kind of thing. These are other kind of community and life supports. And again, you can see the DD waiver offers pretty much all of them. The CCC Plus waiver offers very little, but the DD waivers can fund non-medical transportation. This gets right back to our social and rec. If that person wants a neighbor to drive them to their local kickball or softball league or whatever it is, that neighbor could get reimbursed through the waiver for that transportation. A community guide to help the person better navigate their community, electronic home-based services, which are very cool, like remote monitoring. So for example, it can be things like doors that will lock themselves, stoves that will shut themselves off, pill minders that will pop open and beep until the weight of the medication is taken out of them and you confirm you've swallowed it. Or it can be things like actual people just working remotely. So maybe we've got someone with a disability who's mostly safe on their own, but if they hear a noise or a stranger knocks at the door, they're going to feel a little freaked out. So in that case, pushing a button and within a couple of seconds, someone who's a trained support person coming on a screen and saying, hey, Lucy, what's up? And me being able to say, oh, there's a weird noise. Can you help me figure this out? Or I'm not feeling well today, or I just need to talk to someone for a while. That's a great option. Those remote supports are really making a huge difference for folks because it's hard to pay for staff and find staff to work 24 hours who are just supposed to be there as a just in case. But now with all the amazing tech options we have, it's pretty cool to get those people available remotely. Okay. And lastly, are kind of like nursing and therapeutic services, which are available based upon need. Okay, so how can the waiver work with us on social and rec needs? I'll just underscore this a little bit. So every year with your waiver, you write a support plan. This will be similar, not wildly dissimilar, I should say, to an IEP or other kinds of services where you're looking at the year ahead. What do I need, when, how, from who? And if you have goals like, I want to sign up for a new sport, I want to learn a new hobby, I want to continue going to a sport or hobby that I already take part in, I want someone to assist me in that, those kinds of things, we can look at, can the waiver fund someone to go with you to help you sign up? to transport you, all of those kinds of things, right? So really think about not just daily care needs, but that other important part of us, that social and rec piece, when you're looking at the waiver. I will say there are some shortcomings, like we talked about. If you're looking at a shared setting, the person works in a shared day option or a shared residential setting, staff and vehicle limits are very real to the degree possible that this person has other transportation options. It could be friends or family or public transit. That's great. Sometimes we have staff who we hire through the waiver who by their contract aren't allowed to drive the person. So if you're talking about someone being able to go out in the community with someone, when you're doing this hiring of your agency of the individual staff person, this is an important discussion to have. What are our transportation options? Is the staff willing to ride public transportation with them? Do they have their own transportation? How would they get reimbursed? Those kinds of things. And while the waiver can pay for a staff person to go assist someone in a social rec option or plan for it or transportation, it won't pay the fees. So for example, if the staff person was taking someone to a local bowling league, the waiver is not going to pay for the bowling fees, even though it could pay for the staff and the transportation there and back. Okay, so now we'll kind of move on to, if these waivers sound of interest, how would we go about applying? And for the DD waivers, like I mentioned, the application process is the same. You're not saying, I only want this DD waiver, this community living because I have 24/7 support needs or whatever. You'll explain those needs, but all of those screenings and whatnot are done together through your local community services board, commonly called the CSB. In Northern Virginia, they're all based upon locality. If you live in Alexandria, it's the Alexandria Community Services Board. If you live in Fairfax or Fairfax City, it's the Fairfax Community Services Board. You get it right. If you don't see yours listed, it usually is very Googleable, if you will allow me to use that as a verb. But if you have trouble finding it, just let me know. And then you're just calling them to say, hey, we heard about these DD waivers. Can you send us an application? They'll send you a big stack of paperwork. And as the person with the disability, parent or caregiver, there's nothing odd or shocking in there, right? It'll be stuff you know. You'll send that back with a copy of your diagnosis and your IQ score. And then they'll say, this looks great. Let's meet and do that VIDES, that assessment we talked about in the beginning when we'll talk about your daily needs, and we'll put you on the waiting list. Put a pin in it. We'll come back to that waiting list in just a second. So for the CCC Plus waiver, you're calling your local Department of Social Services, sometimes called Department of Family Services or something else, but it's that same kind of agency, again, based upon your locality. Here, instead of calling and asking for a packet of papers, you're calling and they're going to do a phone screening, which will ask a lot about the things we talked about: hands-on care, bathing, dressing, restroom, medical needs. Those things should sound very familiar if we're talking about CCC Plus waiver by now, right? And if that phone screening goes well, they send out a nurse to meet you in person in your home, and they ask a lot of those same questions again. And then if that goes well, then they'll start the process of enrolling you in the waiver. There is no waiting list, but realistically speaking, we're talking about a program with like lots of layers of bureaucracy and applications and interviewing, applying, setting up for services. So I say all that to just highlight that even though there's no waiting list, it's not as though if you called today, you could actually have services in your home tomorrow. I would say 2 to 4-ish months is pretty usual if you're working in earnest to get things returned quickly and hiring quickly and all those kinds of things. So it can take a little bit longer if those things are slow. Okay, so as promised, we are circling back to the waiting list for the DD waivers. And the reason that I hold on to this for so long is because it is a very complicated topic to talk through. All of the DD waivers, community living, family and individual supports, and building independence, though they offer different services, they share a waiting list. And that waiting list time is really unpredictable, in part because the waiting list is based upon urgency of need. So if you're doing really well and safe and happy and healthy, you may be at the bottom of the waiting list, and maybe the next day there's a terrible car accident in your family and you shoot to the top. Or maybe you had some uncontrolled diabetes issues and you were at the top of that waiting list because you were really struggling, but you had a great nutritionist and a great exercise regime, and you got back down to pre-diabetic levels, and maybe your urgency of need dropped, right? So you can imagine at any given moment, this is constantly shifting. The other piece that's really tricky here is, though there are already people across the state of Virginia that have waivers, to get more in the system, our state government needs to buy or to fund more waiver slots. They're called slots. And there's no mandate for how many of those they do each year. So this year, it looks like they'll fund 1,100 waiver slots for a waiting list of about 14,000 people. So we're looking at 7-ish% of our waiting list being funded this year, but there's some years they fund a lot more. There's some years they fund less. So again, very hard to predict waiting time. I usually tell people, unless you're in a really dire situation, generally multiple years. And when waiver slots are funded, for example, the state funds new waiver slots, they give a pool to Fairfax, a pool to Arlington, Alexandria, et cetera, based upon the number of people they have on the waiting list there. And then those local community services boards that we talked about look at people most urgently in need, and they kind of matchmake. They have actually a volunteer team that does this matchmaking, and they say, okay, we got this many community living waivers. These are the people we think are most urgently in need of those. We got this many family and individual support waivers. These are the people we most urgently think are in need of those. Right now, there is no waiting list for the building independence waiver. So if you are, or your loved one is over 18 and can live pretty independently, you could start getting waiver services right away. If you need to move between waivers because one isn't successful for you, you can do that. And that doesn't involve giving up your waiver and going back on the general waiting list. It's a different process. Okay. Okay, when you are on the waiting list, you are in one of 3 priorities, 1, 2, and 3. The definitions here are provided by the state, and they're based upon how soon you need services. I don't think they're particularly helpful because that's no guarantee of when you'll get services. For example, priority 1 says you need services within a year. I've known people who are on the priority 1 waiting list for many years. What that really means is people in priority 1 get served before people in the other priorities. So once you apply for the DD waivers, you'll be told which priority you're on. The Community Services Board should be calling you every year to confirm, is this right? You know, do you have any news? And if you have news, that means a parent has gotten a new mental health or physical disability diagnosis, and it makes life a lot harder, share that. If the person with the disability is graduating and we don't have any services for them after graduation, share that, those kinds of things. You don't have to wait for them to call you. You can call them anytime you see that, and you can move around on this priority list at any time very quickly, like a phone call quickly, based upon the change in your urgency of need. So make sure your Community Services Board is updated on what you have to have, because that's the only way they know to put you in the right priority. Okay, again, the arcofnova.org/answers is like always the fastest way to reach me, but I'm going to stop sharing my screen and I'm going to look at our live questions that came in. Okay. Oh, someone asked to be put in touch with the Tech for Independent Living team. And you know what? Because I can't easily copy and paste from here, I'm going to type an answer to you about who to email, and anyone else can do it too. So the person who leads that team is Diane Monig, M-O-N-N-I-G, and her website is D for Diane, Monig, M-O-N-N-I-G, at thearcofnova.org. She's wonderful, super smart, and is really responsive. So she'll be able to hook you up with that Tech for Independent Living team. And you can read more about it on our website, thearcofnova.org, if you click like our programs and services tab, and you can see videos about it and all the cool things that they do. Oh, can I repeat how to find the VIDES on the ARC page? Sure. So at thearcofnova.org, there are a few links in gray at the very top, 3 actually. The second one over says Resource Library. And if you click on it, the top of the resource library is an alphabetical menu. So go down to waivers, obviously near the bottom, W. And when you click on waivers, it'll take you to a whole waiver section. It'll be like a 1-page version of what it took me 45 minutes to tell you today, the quick and the dirty. There'll be a longer version that lists the services, and the VIDES will be there, and they're labeled by age. And so they're, like I said, I think that they're generally pretty easy to use, family friendly, but feel free to ask any questions. Oh yeah, someone mentioned that to be eligible for waiver, you need to be willing to accept waiver services. They say within 30 days. Again, to be clear, that doesn't mean you're going to be offered them, but you're saying, oh, I don't just want these services 15 years from now, because I hear the waiting list is really long and I want to be super prepared. You're saying like, yeah, if you offered help, I would take help, which is, I would say, generally a prerequisite of any program you're applying to, but make sure you're saying yes. Is the funding for non-medical transportation available across the whole state? Yes, that's a waiver service, so it is statewide. In Northern Virginia, there's one group that I know that offers it, so I don't know where in the state you are. And it's not in our area, at least, it's not the community services board that offers it. It's a private waiver provider. And you feel like you enroll with the service and you fill out this little sheet that, I mean, it's like this date, I went from here to here, here's who drove me. And it's like a cents per mile reimbursement, and it's not a lot of money. So it's like, I'm making this number up, but like 60 cents per mile, give or take. So it's not going to like be enough to offset the cost of a taxi or an Uber or a Lyft kind of thing. But if you have someone who's going that way, a parent, a family friend, neighbor who's willing to drive you, it can help kind of sweeten the pot and that sort of thing. But it's a private waiver service. It's not offered by the CFB, but the CFB would help connect you with a provider. Hope that makes sense. I will say it's a relatively new waiver service, so there certainly may be areas of the state where there aren't many providers yet. But by continuing to say in your annual plan, I want this service, and that need not being met, all of that data gets submitted to the state and puts pressure on them to roll out development. So never stop asking for a service just because they tell you it's not available then, because otherwise there's no documentation saying people want it, and there's no impetus to have it developed. Who writes the care plan and where do you find their contact information? So the DD waivers have a very significant annual plan where you sit down and you talk about services inside and outside the waiver, what's important to and for the person, their strengths and needs. It's very comprehensive. For the CCC Plus waiver, there's not that case management and same kind of annual plan. Your plan really just looks at the care hours you want under the waiver. If you are using what's called consumer-directed services, meaning you are choosing the care attendants that you want to work with them, you're hiring your own neighbor, family, friends, placing ads, etc., then yes, your service facilitator, the helper, that would write that annual care plan piece that really is care hours. If you're using an agency to staff the person, that's what you would write. Someone wrote Prince William County is missing. That's because we don't serve Prince William County. The ARC of Greater Prince William does, but we are very friendly. I used to work at the ARC of Greater Prince William, so I don't usually put their contact information on our slides, but because they do a lot more direct services, like they offer residential and employment programs and those kinds of things, whereas we don't, we answer a lot more questions. I'm happy to have people in Prince William talk to me anytime. For the building independence waiver, only some are allocated per region, right? So like I talked about, there's that kind of matchmaking process. So when waivers are funded, there's a team that looks at based upon who we have in this region and the waivers that we got funded and how do we pair those up. In Northern Virginia right now, there is not a waiting list for the building independence waiver. Again, that waiver for people over 18 who are pretty independent. There's no recreational support in the CCC Plus waiver. The CCC Plus waiver, most people use for that one-to-one caregiver piece. And if you wanted to use that one-to-one caregiver to help the person look up social and rec options, travel to them, engage in participating in them, right? So for example, if that person wanted to, I mean, I keep using a local kickball league, but if you wanted to have that caregiver go and help the person participate in that kickball game, you sure can. But that's how that person chooses to spend the time with their one-to-one caregiver. There's not a separate service that's social and rec based. How does social services play with Medicaid and waiver? I am not sure I understand exactly what you mean by social services, so any clarification you can offer would be great. Who performs employment support through the waiver? People who are enrolled with the waiver to provide employment support, and that's not meant to be a circular answer. It means for any waiver service, generally, someone has to sign up with Medicaid and say, here are my qualifications. I'm going to offer these services. This is what it's going to look like. This is how I'm going to hire and train people. So at the arcofnova.org, in our services section and resources section, you can click on a link that says transition points. That's our umbrella program that provides information across the lifespan. And if you click on transition points, you can find our big transition points day and employment guide, and it lists the providers in Northern Virginia that are enrolled through the waiver and their website and their contact information and those kinds of things. You can also ask your support coordinator to help you figure that out, but there's a lot of them. If you're paying for special education privately and the child needs ABA, et cetera, and the family can't afford it, can that get a priority one child off the waiting list? So the criteria for being on priority one does include things like this child has significant support needs, which could be behavioral support, medical, you name it, that we're not successfully meeting without the waiver. We don't have the money, we don't have the people at home, we don't have the knowledge, skills, and ability to meet those needs. The waiver is not meant to supplement or supplant special ed services. So if you said the person's having trouble at school, the waiver staff can't go into the school, so that wouldn't be enough. But if you said this child's having significant behavioral support issues at home, regularly having a crisis, those kinds of things, then that may be a reason to get someone higher up on the priority 1 waiting list, and those are the people that get those waivers. Is there anyone besides the CCC Plus provider that can help a contractor for home modifications? So as I mentioned, there's a waiver service called environmental modifications. It's up to $5,000 a year to adjust the home or the car of the person with a disability, like wider doorways, accessible bathtub, right? Like are pretty standard answers to that. So yes, Kelly, Kelly, Cove, and Lorton, like the part of Fairfax, Lorton builders, are the 2 environmental modifications providers I know in Northern Virginia. In my experience, it's a relatively lesser used waiver service. So reaching out to one or both of those people to say, this is what my need, here's who my waiver provider is, like, can you work with me to help make this work? They're really smart because that's all they do, right? Is work with waiver environmental modifications. So sometimes that's a good way to get the ball rolling. That's pretty successful. VIDEs are completed by support coordinators who are trained to complete them. Yes, I'm sorry. I thought I clarified this, that you can write out on your own VIDEs, but the person who does it, the intake, won't take yours, right? They still have to, I think I said they still have to meet the person and still have to answer those questions. Absolutely. But I certainly know as a parent, it can be really stressful to try and remember examples of the 50 whatever questions that are on the VIDEs at the top of your head. So if you want to write it out ahead of time and bring it with you for your own notes and preparedness, great. And all the better to practice, right? When I apply for services with my son, we spend a lot of time practicing ahead of time because most of his life we spend trying to emphasize his strengths and his talents. But there's sometimes when we're applying for things when we're stressing his needs, like with the VIDEs, and I want him to understand why we're saying what we are in that context. I think it's incredibly important. All right, my child has the CCC Plus waiver, so I believe we're priority 3 on the DD waiting list, and that can happen, right? So maybe, for example, the person has medium or high needs, but the CCC Plus waiver is meeting most of those needs. That can push us down the waiting list. When she ages out of school in 2.5 years, will her priority level switch to level 1? So the priority 1 criteria say if the person is like aging out of school, like at 22, like we're out of school, up until that person turns 27, and we don't have day or employment or other kinds of supports lined up that we need, that can switch someone to priority 1. With that being said, it's not unusual for me to hear from a parent who's so upset that their child turned 27, 28, 29, they're no longer eligible for that priority 1 on that need basis. You'd have to have another reason to be in priority 1 at that point. My son has the community living waiver. Are there funding that pay for special needs summer camps? Not through the waiver. I'm trying to remember, and someone else feel free to chime in here if there are any camps that I remember that can successfully bill Medicaid. And in the back of my head, I feel like there may be somebody. Sometimes local community services board, this is rare, I don't want to make big promises, have some funding that they can use to help this person. If it's a school-aged child and they're having crises at school, you can talk to the school social worker about Children's Services Act and see if there's a way to get flexible funding for that. Grant programs, again, at the arcofnova.org, across the top, that resource library section I mentioned says financial assistance. And there's like a 2-page handout, and there's no like brilliant, amazing, easy money ideas there, that have ideas on some financial assistance you could use for summer camps. And for people on the waiting list, not who have DD waivers, but who are on the waiting list for DD waivers, there's funding each year called Individual and Family Support Program money that's between $500 and $1,000, depending on your situation and your priority on the waiting list, that can be used towards summer camps. But if you have the waiver, like I said, that financial assistance document, talking through the school social worker or your local community services board, grant programs, those kinds of things. If we have questions about Medicaid, do we need to ask social services? It depends on what your questions are. You can ask me anything if you want. Just shoot me an email or go to the arcofnova.org/answers and put your question there. It only comes to me. And I'm happy to help you if I can. I can't, like, for example, log into your Medicaid system and see things in your file. I can answer questions about, oh, here's the general rule on this and those kinds of things. So if it's about your child's specific Medicaid and you need an answer very specific to your case, then yes, you would work with their Medicaid worker at Department of Social Services. But if it's like, what's the financial criteria for Medicaid that would apply to everyone? Those are good questions for me. Okay. Any tips on getting the Community Services Board contact to agree to move my son from community living from family and individual support waiver? You're not hearing back from them. So a lot of this, I mean, CSB support coordinators have a ton on their plate. And unfortunately, we've seen a lot of turnover, meaning like new staff in that position. And it's a hard job to learn. You have to know so many things. And it's a lot of skills. So I will say it's not wildly unusual for me to hear that someone's not hearing back from their support coordinator, which usually means they're snowed under. You can always ask to speak to a community services, like your support coordinator supervisor, who usually has more experience and may be able to better help navigate tricky situations. But usually when you're looking at moving from one waiver to another, you're looking at showing we've tried for an extended period of time to use this waiver and it isn't meeting our needs. For example, my loved one needs residential services and we can't find a provider. We tried to interview this many people, or we tried the services and they weren't adequate, those kinds of things. So you can start documenting those kinds of things, but working kind of up the chain of command at your Community Services Board can help, because again, I don't think I've ever seen a situation where a CSB subordinator didn't want someone to have the help they need. They can just be really overwhelmed with all of the very many things that they have to do, especially if they're relatively new to that job. So again, all the documentation you have about the services you have tried and the lack of success you had with them is one of your best tools in advocating for moving from one waiver to another. I am a good contact person for additional questions about this, but I'm very rarely at my desk. So that's why I shared the email on the arcofnova.org/answers. If you can send me a message, we can certainly set up a time to talk on the phone or Zoom, whatever you prefer. But cold calling me almost never works because of the wild nature of my job. Oh, Chandra, thank you. SOAR, SOAR camp. Thank you. That sounds familiar. Accepts respite hours under Medicaid. So I can't remember all the details about it. But thank you so very much for sharing that. That's super helpful. Okay, so someone not receiving a waiver that needs. Okay, got it. So I don't see any more questions and it's 1 o'clock. So I'm going to go ahead and wrap up our recording here and I'll stop that now. I just wanted to thank everyone so much for coming and for their questions and for the answers that you all shared with each other, right? The DD community is so tight knit and so resourceful. It's a really wonderful thing to be a part of. So thank you so much for your time.